Hi, everyone. Thank you so much for coming. Thank you, everyone, for organizing. Thank you, Gina, Peter, and everyone else. I can't even imagine how hard it is to put an event like this, and I really appreciate, and I'm sure all of us really appreciate everything. I really like bedtime stories. I'm just gonna start with one. Once upon a time, there was a man who found a butterfly cocoon in his backyard, and he saw through the cocoon that there was a butterfly trying to struggle and it was trying to squeeze its way out. But it was unsuccessful. So the man took a pair of scissors and he cut his way around the cocoon. And what he saw was that when the butterfly came out, its wings were shriveled and its body was completely swollen. The man looked at the butterfly, expecting at any moment for its wings to emerge and for it to fly away. But that never happened. What the man didn't realize in his haste and his kindness was that the struggle was nature's way of pushing fluid into the butterfly's wings so it could be strong enough to fly. It was the struggle that would have created the miracle. There are two things that I can identify with growing up. The first is airplanes. I was born and raised in India, and when I was 10 years old, my dad said something to me I'll never forget. He said, "Son, we're moving to the kingdom of Saudi Arabia." And I was like, "Wait, what? What's going on?" And it was insane because it was a huge change. It was a huge culture shock, language, all of these things. And one time I remember in school, I used to go to a Saudi school, and the kids used to be really, really racist. And they used to throw stones at me and my sister for not being Saudi and for not being Muslim. And what I found was that that was just an exception to the general rule that I found having lived in Saudi Arabia, in New Zealand, in New York City, in Houston, Texas, and at Stanford. That people are really, really nice. That in general, the core, at the very fundamental level, the things that bring us together are stronger and far outnumber the things that divide us. And what I've found, and the second thing that I said I'll identify growing up were Scrubs, not the TV show, but rather Dr. Scrubs. My parents were both physicians. And growing up, I used to think it was so incredibly cool that they used to come home every single day and talk about their patients. They used to talk about how they made a difference in the lives of people every single day. And when I was growing up, I talked to my mom about what it is I wanted to do. And my mom told me something that whatever you do, do something that makes someone else's life a little bit better. And it was an ideal that I espoused not just from my parents, but also from the reading. So I used to read a lot of Gandhi. And what Gandhiji said was that the best way to find yourself is to lose yourself in the service of others. And he called it seva, or selfless work. And I found this to be true when I was a freshman at Stanford. And it was like this one spring quarter morning that I found myself sitting in my dorm room and trying to decide what I wanted to do with my life, and not being able to find an answer. And it was this burning desire to make someone else's life better and also find out for myself what I was here for, that I decided to take time off from Stanford and work full-time for a free clinic in Galveston, Texas, St. Vincent's Free Clinic. And Galveston is a place that was undergoing a lot of changes at the time. Galveston is a place with the highest number of uninsured people in the entire country. Over half the city of Galveston does not have health insurance. And add to this things like the economic recession, which led to more people losing their jobs and more people losing their health insurance. And as I was a full-time volunteer at this clinic, I started noticing a pattern. And it was a pattern of chronic preventable disease, things like type 2 diabetes, hypertension, and depression. And what I started noticing was that people were suffering from this disease, and it didn't make any intuitive sense, because if these diseases are preventable, why do people still suffer from them if they can prevent it? And not only did it not make any sense, but it was also difficult for me to see people going through things like blindness and hearing loss and amputations and pain every single day, every waking moment. And it was not just a big problem, it was also a personal problem for me. Because when I was 18 years old, I was diagnosed as being morbidly obese. That's me on the right. Over. I was 225 pounds, and losing those 65 pounds was the hardest thing that I've ever done in my life. But it was also the most meaningful and also the most empowering. So I knew that change was possible, and I knew that I could do something to help these people. But I didn't know how, so I did some research, and I found that if people are given the right resources, if people are given education that can help them, then that is something that they can do to fight their own disease. And I counseled over 100 patients at this clinic, giving them advice in terms of recipes and exercise plans, smoking cessation kits, things that they could do, they could take charge by themselves and make a difference in their own lives. And what I found was that these people didn't need motivation. My patients didn't need to be motivated to make the change, but rather they needed someone to show them that change was possible, and they needed someone to give them the right resources to do so. It was 100 patients, it was 100 miraculous struggles. And one of these miracles was Mrs. Martinez. And Mrs. Martinez is someone who on the surface seemed like a very typical patient. She was obese, she was diabetic, she was middle-aged. But at the same time, she was no typical patient for me because she told me her life story. She told me something she had never told anyone before. She told me that up until 3 or 4 years ago, she was a happily married woman with 3 kids, a husband. But for some reason, her husband divorced her, her children estranged from her, she became homeless, she became diabetic, obese, hypertensive, depressed. And she told me that she was considering ending it. She was considering suicide. And I didn't know what to do. So I called in my supervisor, and we talked to Ms. Martinez. We gave her counseling advice. We gave her access, or we gave her resources to access homeless shelters and resources that could improve her life, her diet, started on an exercise regimen. And 2 weeks later, when Mrs. Martinez came back to the clinic, we noticed something different. We noticed that she no longer did she talk about her problems, but she talked about her aspirations. She had conviction and she had confidence in her voice. She talked about how she had always wanted to be a writer, and she always wanted to write a cuento, a Spanish book of short stories. And she told me something I will never forget for the rest of my life. She said, "I will dedicate my book to the both of you." So at the clinic at St. Vincent's, I found that if I could make a 50-year-old obese diabetic woman feel powerful and independent, that is why I do what I do. And I want you to know that St. Vincent's is still going strong. I emailed them 3 weeks ago asking for some pictures, and this is what they sent me. And this is actually a quote from the Bible. It's from Hebrews. And I really like it because to me, it means that when you help someone through a struggle, when you help uplift them, not only are you affected by that, but you never know who you might meet. You might meet angels. So back at Stanford, I pondered, because this was not an isolated problem. There were hundreds of thousands of Mrs. Martinez's all over the country. And every minute, 10 Americans are diagnosed with a chronic preventable disease. And I knew that the problem lied in lack of access to education. Education can solve over 64% of problems related to chronic preventable disease, like type 2 diabetes and hypertension. And I knew that of the 2,000 free clinics in America, serving over 2 million patients, over 75% of them didn't have access to any health education program. That all of these patients, over 1.5 million patients, had no education at the only healthcare provider they had access to. So I founded Anjna. I was 19 years old, and I said, I'm going to make this my problem, that this is my battlefield. I started to dig deeper. I identified 4 key problems with current educational efforts. The first one was that a lot of educational efforts at free clinics were utilizing obsolete materials, materials that they had gotten from hospitals 20, 30 years ago, from the 70s or the 80s, no longer relevant, and in some cases dangerous. The second problem was that a lot of free clinics had educational materials and information that had a lot of text in it. But the problem is that people don't like reading text. I mean, people like pictures. And the second problem was that a lot of people just couldn't read. They had a fourth, sixth, and some people were even illiterate. The third problem was that there were a lot of language barriers. A lot of these educational programs were only available in English or Spanish. And a lot of these underserved populations came from diverse backgrounds from East Asia, Southeast Asia, and Africa. And the final, and perhaps the most important problem, was that an issue such as mental health that is so heavily stigmatized in all societies, let alone low-income underserved communities, was practically non-existent in any of these programs. So I decided to recruit a team. It was brilliant Stanford students, functioning on Red Bull and pizza, working in their sleep, with all kinds of talents, from web design to translation to research to graphic design. And these people built incredible things. What we wanted to do was we wanted to create resources, quality resources, design-oriented resources, tailored resources that could enable free clinics to educate their patients. And this is just a picture of our team, the fabulous team that we created. We started with a few volunteers who wanted to come together and build this database, build this wealth of information that anyone in the world could utilize to educate. And as we built our network of volunteers, you got people to translate educational materials into various different languages. You got people to build curriculum. You got people to contact clinics and establish relationships with free clinics. And we got people to do research on what were the most effective ways of getting people to do behavior change. Over 10,000 hours of volunteer work later, we built a health education database covering issues from diabetes to heart disease, to mental health, to eye health, to nutrition, to exercise, issues that were impacting the lives of patients at free clinics every single day. And we did this for a grand total of $0. This is just one testimonial from one of the clinics that we worked at, Human Labs Clinic in Oakland. They said that you help initiate a conversation with the physician. That the first step in any empowerment program or in any program that helps people take charge of their health is asking questions. And the only time people ask questions is if they're educated about it. So we started asking more questions. We started asking what were simple interventions that we could utilize that could have tremendous impact at free clinics. And we found out that text messaging was one of the answers. Because patients at free clinics were 40% more likely to follow through with an educational program if they were given simply a daily reminder about it, like check your blood glucose today, or take your medication, or remember to work out. And we partnered with this company called Medic Mobile to create these databases of text messaging that could empower free clinics with just a laptop and a GSM modem to become a repository of text messages for their patients at the cost of less than $1 per patient for 6 months. And the second solution was iPads. Because we found that over 3 hours were wasted every single time a patient visited a free clinic, just waiting, just sitting around, 3 hours. And we found that the time that is wasted browsing People magazine can be used for education. And so we're working on creating these interactive modules that are going to be placed on iPad kiosks at free clinics, used for education, interactive, utilizing games and design technology. And our hope is that for all these programs to be implemented in the 2,000 free clinics serving 2 million underserved, much-needed people in America. So what I've realized through St. Vincent's, what I've realized through Anjna, and what I've realized through my experiences working with brave and motivated patients all across the world is that patients are motivated to change. We just need to provide them the right resources to do so. And that struggle that causes us to make a positive change is something special. I believe that, well, I know that struggles, and we all know that struggles are a daily part of our life. We all struggle with things like paying the bills, or taking the kids to school, or in some extreme cases, justifying our marriage to the government. But at the same time, I also believe that there are some special struggles that I would call miraculous struggles. These are struggles that empower us. These are struggles that when we go through them, we realize how far we have come from where we started. These are struggles that shape us because they help us do things we never thought were possible. Whether it is Mrs. Martinez becoming a writer after being on the brink of suicide, or the thousands of patients suffering from chronic disease every single day. These are the miraculous struggles. So the next time you're faced with a miraculous struggle, grab it, seize it, hold on to it. Because you never know when the light at the end of that cocoon is going to turn bright, and your wings are no longer going to be shriveled, but elegant and gorgeous. And you're going to take a look back, and you'll see what you left behind. You'll take a look forward, take a deep breath, and then you'll fly away. A miracle. Thank you.